We've been talking about distensibility, no? Medyo mahirap-hirapan. Wait lang, kasi yung cursor nakakaabala. Yeah. Arterial distensibility allows the blood to be dumped into the aorta. Kasi during systole, the LV contracts and the stroke volume is like 120 ml. This will be delivered to the aorta agad-agad in a short period of time. So the aorta has to accommodate this blood, 120 ml. And without distensibility, hindi ma-accommodate yung volume yan. But the aorta has a capacity, or has an ability to distend. It will expand, so it will be able to accommodate the 120 ml stroke volume. Okay? And there is also increasing resistance as you go along the circulatory tree. From the lumen of the aorta na beaker, pababa, paliit ng paliit from medium-sized arteries, mas liliit pa yon sa smaller arteries, and then liliit pa yon sa arterioles. Okay? And because of this, the resistance increases and the pressure also declines, as well as the flow. We have already explained that. So, another benefit of distensibility, aside from allowing the vessel to accommodate a large volume of blood, is distensibility helps the flow not only during systole, but also during diastole. Because during systole, the LV contracts, it generates. But during the diastole, because the LV, so it will somehow, and so distensibility has to fund volume of blood. And at the same time, it allows the flow of blood to be still continuous even during diastole. Okay? So distensibility and compliance is different. Yan yung mahirap kasi parang sa utak natin halos parehas lang naman siya. But in finer details, they are actually different. But they are related, but different. Okay, when we talk about distensibility, you are looking at the fraction of change of volume per change in pressure. Whereas compliance, you are looking at the amount of volume in every change in pressure. Woo! Paano yan? So, for example, 10 ml yung amount ng pagtaas ng pressure by 1 millimeter mercury, the volume has also increased by 10 ml. So therefore, the compliance is just 10 ml per every 1 millimeter mercury rise. But distensibility will be like 100% kasi 10 ml siya, 10 ml siya after. So distensibility. So magkaiba sa distensibility, you are looking at the fractional change of volume with response to change in pressure. But compliance, you are just looking at the volume. The change of volume is ml per millimeter mercury rise, while distensibility is percentage per millimeter mercury rise. In hemodynamics, it is this compliance, okay? Naintindihan niyo ba yun? Anyway, later we will, if hindi niyo naintindihan, we will...
Copy ka, Doc.
I will...
Doc, copy.
Sorry, data lang kasi. Hi.
Dok, magkasugit resistance at internet, di remote flow.
Plan ng... okay, let's wait. Ulitin ko ba? Ulitin ko yung distensibility and compliance.
Yes po, Doc, please.
Okay. Distensibilities, you are looking at the fractional increase of volume in every rise in pressure. Kung ilang percent yung pag-increase ng volume for every rise. You're just looking at the every rise in pressure. For example, yung laman ng isang vessel. And then, tumaas yung pressure by 1 millimeter mercury. Pagtaas ng pressure by 1 millimeter mercury, tumaas din yung volume by 10 ml. So the compliance is 10 ml per 1 millimeter mercury increase. But the distensibility of that vessel is like 100% per 1 millimeter mercury rise. Naintindihan niyo ba yun? So, for example, 10 ml siya before, and then increase yung pressure by 1 millimeter mercury, but the volume only increased 1 ml. Ibig sabihin, the compliance ml per 1 millimeter mercury, while the distensibility is only 10% mercury rise in pressure. Okay? So it is rather than distensibility that is more important. The rise in volume with respect to the rise in pressure, rather than this is what we call as stress relaxation. So, for example, we have a vein. Tapos biglang you ejected, you transfuse a volume of blood. What will happen is there will be a sudden increase in hemodynamics, an increase in volume. Because you increase the volume, the pressure will suddenly increase. Over a period of minutes, let's say 5 minutes, the vessel, the smooth muscles, will relax. And that is the reason why the pressure will decline even if you did not change the volume. Parang the volume is still the same. You have volume, muscles in the arteries. The artery has been compliant and has expanded. The distensibility has increased, and so the pressure will also decline. Now, say for example, if you removed the volume of blood na transfuse mo, there will be a sudden drop of volume as well as a sudden drop of pressure, again in hemodynamics. Okay? Over a period of few minutes, the smooth muscle will contract again, the vessel will vasoconstrict, and somehow the pressure will rise again. This is reverse delayed compliance. So, yes, this is what we call as stress relaxation. It allows the veins to return to its original pressure after blood is removed or added to it. Kung wari, nag-transfuse ka ng dugo, isang 500 ml of blood, if you have transfused 500 ml of blood, the pressure of blood and the volume will rise as well as the pressure will rise. But over a period of few minutes, the pressure will decline even if the volume of blood remains the same, because the smooth muscle in the arteries will relax, accommodating the volume and therefore decreasing the pressure. Now, if you remove the 500 ml immediately, there will be a sudden drop of pressure. And the volume also has decreased, and therefore the pressure has decreased. Now, over a period of few minutes, the smooth muscles in the arteries or in the vessel will contract. It will vasoconstrict the arteries or the vessel, and therefore the pressure will go up again.
Excuse me,
even
Doc.
if you have not. So this is what we call as stress relaxation. If you put
Doc, choppy po, super choppy.
Hello.
Kanina pa po.
The beginning pa po.
Oh,
Sorry, Doc.
okay.
Magkusog it resistance, Dok.
Dito sa ito, dito siya mahina or dito na?
Hindi na, Doc, have vascular tensibility.
Okay. So, nakikita niyo yung graph na to?
Yes, Doc.
Yes.
So, for example, nag-transfuse ka ng dugo, 500 ml. Because you transfused a blood, the volume will rise and the pressure will rise. According to hemodynamics, and every increase in volume means an increase in pressure. Tama?
Yes, Doc.
Now, over a period of few minutes, the smooth muscle in the arteries will relax. So the size of the lumina of the arteries will increase. And because of that, there will be a drop of pressure even if you have not changed the volume. Narinig nyo yun?
Yes, Doc.
Okay. So this is what we call as delayed compliance. And this is because of relaxation of smooth muscle. So this allows the vessel to decrease the pressure despite an increase in volume. Kuha nyo yun?
Yes, Doc.
Now, say for example, you have removed the 500 ml immediately. There will be a sudden drop of volume as well as a sudden drop of pressure. Again, in hemodynamics, a decrease in volume means a decrease in pressure. Okay? So, over a few minutes, the smooth muscle in the arteries will contract. It will vasoconstrict the vessel. The pressure will rise even if you have not changed the volume. Kaya babalik siya sa normal pressure. This is what we call as a delayed reverse compliance. Okay? So this is compliance is ability of the veins and the arteries to return the original pressure even if you add or remove volume of blood. Parang compensation siya. Because without this ability, the blood pressure will not go down if you add volume. And the blood pressure will not go up if you remove volume. Naintindihan niyo ba yon? Gimbuno ka, nagdurugo ka, nabawasan ka hindugo. Somehow, there are mechanisms to return the BP back to its original BP by a lot of mechanism. And one mechanism is stress relaxation. Okay?
Yes, Doc.
All right. You can just interrupt me anytime kung pangit yung signal. We have talked about pulse pressure before. Let's try to expound more. This is the difference between systolic pressure and diastolic pressure. So if the BP is 120/80, the pulse pressure is 40. So look at, if you put a catheter in the aorta, ito yung makikita mo na record. There will be systole and diastole. Systole and diastole. So 120 millimeters mercury during systole, and it goes down to 80 millimeters mercury during diastole. You just have a little bit of indentation here. We call it a sharp incisura, and this is because of the closure of the aortic valve. Kuha?
Yes,
Now,
Doc.
if you put a catheter on the main pulmonary artery, it will be the same shape, but a lower pressure, because the pressure in the main pulmonary artery is about 5 during diastole and less than 35 during systole. So, gaganon, mababa. Dito siya siguro, kung bababaan pa na, dito siya, paganon siya, and then pababa, paganon siya, and then pababa, with an incisura because of closure of the pulmonic valve. Nakuha niyo yun? Okay. There are 3 conditions that increases pulse pressure. This includes aortic regurgitation, PDA, and atherosclerosis. Of course, I've talked about sepsis before, but that's not in cardio anymore. So in cardio, ito yung tatlong differential diagnosis. So in stroke volume. And of course, by a little bit in the compliance. So in atherosclerosis, what happens is there is a decrease in compliance of the artery. So the artery does not expand. It does not accommodate the large volume of blood during systole. And therefore, because of decrease in compliance, the pressure increases. Kuha? Kaya in atherosclerosis, it goes up to even, let's say, 180. The diastole is not affected because during diastole, pag contract ni LV, the aortic valve will close. So hindi affected yung diastole. So there is a sudden rise of pressure and it goes back to diastole. But there is still incisura because the aortic valve, normal naman yung closure. So this is the shape of the pressure curve in atherosclerosis. What is affected is just an isolated increase in systolic pressure, but no change in diastolic pressure. Now, because you have increased the systolic pressure and the diastolic pressure remains to be the same, the pulse pressure will increase. Kasi 180 minus 80, ilan yun? Edi about 100, tama ba ako? So from 40 millimeters mercury na pulse pressure, it has increased to 100 millimeters mercury in atherosclerosis. Okay? Now, patent ductus arteriosus also increases the pulse pressure because what happens is during the diastolic pressure drops tremendously. It goes down below 80 millimeters mercury. And this is because during the diastole, the blood will go into the patent ductus arteriosus. Kasi you have a left to right shunt here. The pressure in the aorta is higher than the pressure in the main pulmonary artery, even during the diastole. And that's why during the diastole, there will be a flow of blood from the aorta into the main pulmonary artery. And that's why the pulse pressure will drop during the diastole. Now, during systole, the pulse pressure, the systolic pressure will rise because of an increased flow. Diba, during systole, the pressure in the aorta is still higher than the main pulmonary artery. And so there will be an increased flow of blood into the lungs, an increased volume in the left atrium, an increased volume in the left ventricle. Therefore, pag contract the left ventricle during systole, there will be a lot of volume that will go to the aorta. An increase in volume means an increase in pressure. That is a basic hemodynamic. And so the systolic pressure will also increase. Now, there is parang sobrang taas ng systolic pressure, bumababa din yung diastolic pressure, and that is the reason why the pulse pressure will also increase in PDA. The closure of the aortic valve is not affected. That's why you can still see the incisura here. Aortic regurgitation. During diastole in aortic regurgitation, the aortic valve does not coaptate well. It does not close properly. And because of that, there is a regurgitant volume of blood that returns from the aorta into the left ventricle. Dapat wala, kasi dapat close si aortic valve. Dapat walang magbabalik na dugo from the aorta into the left ventricle. But because there is malcoaptation of the aortic valve, there is a regurgitant volume. So, because of that, the diastolic pressure will decline. Kasi dapat during diastole, magclose sa aortic valve, whatever amount of blood in the aorta during diastole, yun dapat yun. But because the blood still flows back into the LV, decreasing the volume in the aorta during diastole, the diastolic pressure will decline. Okay? During systole, the pressure increases because there is an increase in end diastolic volume. During diastole, the LV receives two amounts of blood. One, a blood coming from the left atrium, and second, a blood coming from the aorta, the regurgitant volume. Kaya dumadami yung end diastolic volume. And because of this, when the LV contract, there will be a lot of volume that will be delivered to the aorta, doble. And so the systolic pressure will rise because the volume increases, means the pressure will also increase. Kuha niyo yun? So in aortic regurgitation, both systole, the systole is increased and the diastole is also increased, causing the pulse pressure to increase. But you cannot see incisura in aortic regurgitation because the cause of incisura is the closure of the aortic valve. In aortic regurgitation, there is malcoaptation of the aortic valve, and because there is malcoaptation, the incisura is absent. Koha? Now, the pulse pressure will decrease in aortic stenosis because what happens is during systole, the aortic valve does not open properly. It is stenotic, and therefore the amount of blood that goes into the aorta is decreased. Because of a decrease in volume, there is also a decrease in pressure. The diastolic phase is not affected. So in aortic stenosis, there will be a decrease in pressure, and the diastolic pressure is not affected. So because of that, the pulse pressure will somehow decline. Okay? This is how to get a BP. Kasi meron tayong mga students na non-medical. Although siguro alam nyo na how to get a BP, but this is in your book. We have to just run through these. There are two ways to get the BP. It's palpatory or auscultatory. When we say palpatory, ito yung nag-inflate ka, and then you slowly decrease the BP, and then you just palpate. You don't use the stethoscope. Now, the first pulse, pag bumalik na yung pulso, let's say at 80 millimeters mercury, doon mo nakapa yung pulso sa brachial artery. That's the palpatory BP, meaning you will say palpatory 80. Walang diastole. Kasi pag ano na siya, palpatory, pag ma-feel mo na yung pulse at 80, dire-diretso na yan. Kahit i-decrease mo na yung cuff to 0 millimeters mercury, dapat may pulso ka pa rin makakapa. So wala siyang diastole sa palpatory method. Systole lang. So if my residents or intern or clerk will call me and say, Doc, the BP is decreased. I cannot appreciate much the BP, but I was able to get a palpatory BP of 70/40, ginu-joke ako ng student. Okay? Now, auscultatory method, ito yung may systole ka and diastole. This is the time when you increase the pressure on the cuff and it will occlude the vessel. And so wala ka nang maririnig na sound. The sound is what we call as Korotkoff sound. Now, when you deflate, the pressure on the artery will also decrease, and that's why there will be some flow of blood. Now, when this flow of blood will jet into the aorta, not in the aorta, sorry, in the brachial artery, you will hear the sound, the regurgitant sound, or the jet of the volume, the jetting into the vessel wall. When you hear that first sound, that's systole. And then when you further deflate the cuff, open again yung vessel, the flow will now be laminar flow. And then you cannot hear the Korotkoff sound anymore. So once you don't hear the Korotkoff sound, that's the diastolic pressure. So when we say 120, dun mo first narinig yung Korotkoff sound. And when you say 80, 120, 80 na BP, the 80 means to say doon mo na hindi narinig yung Korotkoff sound. Okay? So these are a lot of different types. We have mercury. We don't use the mercury anymore because of safety. What we use are aneroid, but this has to be, as well as the electronic type, but this has to be calibrated every now and then. So ganun lang ang nangyayari. You wrap the cuff around the arm of the patient, you inflate the cuff, and then place a stethoscope over the brachial artery, and then you release the valve to allow the air out and slowly deflate the cuff. And so you listen for the Korotkoff sound. When you hear the sound, the first sound, it's because of a turbulent sound produced as blood spurts through the partially opened artery during systole. And as the cuff pressure is continually decreasing, it will open the vessel more, and the artery is closed during diastole, but as the cuff pressure continues to decrease, the brachial artery partially opens during diastole, and the sound becomes muffled in character. And then eventually that sound will disappear, and that's what we call as the diastolic pressure. Okay. Here. Now, let's go to veins. Mabilis na lang to. I have been talking about the pressure in the right atrium. It's 0, while the pressure in the aorta is, let's say, 120. Because of this difference, pressure difference, there is flow from the aorta back into the right atrium. We want to measure the pressure in the right atrium because we want to look at the central venous pressure. We want a lower central venous pressure because if the central venous pressure, meaning the pressure in the right atrium, will go up as much as 6 millimeters mercury, mahihirapan si inferior vena cava to drain into the right atrium. Okay? And so if the blood cannot drain into the right atrium, there will be pooling of blood in the lower extremity and it will cause edema because pag tumaas ang pressure in the veins, di ba dapat capillaries should have higher pressure than the veins para makaka-flow. But if the pressure in the veins will rise, hindi makaka-drain si capillary to the veins and so blood will seep out into the interstitial space causing edema. So in order for the vein to drain into the right atrium, if the right atrial pressure increases, the venous pressure has to increase. Okay, it has to do something to increase the pressure para makadrain siya to the right atrium. Okay, so right atrial pressure is regulated by a balance between the ability of the heart to pump and the tendency for the blood to flow into it. Output should equal venous return. So whatever the output in the aorta, in the LV, should equal the input. Kasi kung lumabas 120, yung bumalik sa right atrium 100, saan napunta si 20 ml? So there must have been somewhere, may nagtago ng dugo or lumabas yung dugo. So gusto natin equal sila. So sinabi ko na to, when the atrial pressure rises above 6 millimeters mercury, there will be a rise in venous pressure. Kaya yung mga jugular veins, it will be distended. Lalaki sila because of an increase in volume and an increase in pressure. Kasi nga, they cannot drain into the right atrium. Okay? So when a patient venous pressure near the ground is higher than the venous pressure at higher level, for example, ang isang pasyente ay nakatayo for, let's say, 30 minutes. Because of gravity, the blood will pool in the veins and there will be an increase in volume in the veins. There will be an increase in pressure provided that, now, yung pressure hindi naman tataas if the vein has good capacitance. So magdadilate si vein, mag-expand si vein. So kahit nag-increase yung volume, somehow bababa yung pressure. But because you have been standing for more than 30 minutes, na ano mo na na ubos mo na yung capability of the vein to distend, and then there is still more blood being pulled in the vein, tataas yung pressure. And that's why if a person is standing for a longer period of time, the pressure rises up to 90 millimeters mercury in the lower extremity. Now, contraction of the gastrocnemius compresses the vein and it somehow ejects blood up or back into the right atrium. When you decrease the volume in the vein, somehow the pressure will also decrease. Now, we don't want the venous pressure in the lower extremity to be elevated because, again, if the venous pressure will rise, capillaries cannot drain into the veins and therefore blood or the volume of blood will dissipate into the interstitial space, causing edema. Okay? There are also certain areas na tumataas yung pressure ng vein. For example, here in the shoulder, kasi yung vein, subclavian vein, will pass through a small area in the shoulder. It's being compressed. So somehow the pressure rises to 6 millimeters mercury. In your arm, kasi pump ng pump, so the veins are being compressed. So the pressure is also increased up to 35 millimeters mercury. In the abdomen, because of compression of a lot of organs, the inferior vena cava will be compressed, especially during pregnancy because of the baby expanding uterus, mako-compress yung inferior vena cava. So somehow, because of that compression, the pressure will rise up to 20 millimeters mercury. Now in pregnancy, that's the reason why nagkakaroon ka ng edema, because of the compression of the inferior vena cava. Compressing the inferior vena cava means the pressure in the inferior vena cava will increase, and then the capillaries cannot drain into the veins, and then the volume of blood will go into the interstitial space, causing edema. Kaya ganun yun. Okay? Now, may sinasabi sa skull kasi nga negative pressure doon, the sagittal sinus has a pressure of, is also negative 10 millimeters mercury. In fact, pag nag-oopera sila, and then pag meron kang air na maipasok sa vein, sa sagittal sinus, because it's negative pressure, isasuction yung air and it will cause air emboli. Kaya maingat yung mga surgeon na hindi maingat sila sa pagsusuction, kasi pag makapush ka rin ng air, mahirap yun. It will cause air embolism. Negative pressure kasi ang sagittal sinus. Okay, the veins has valves, and this has an important mechanism because every contraction of the muscles, it will compress this vein and blood, the pressure will rise. So it will push this valve up, open, and the blood will go up. And then, kunwari nag-relax na si muscle, the pressure decreases, so blood will go back, but because this valve will close, hindi na siya makakabalik. Dito na naman. So, ang delivery ng blood is paakyat lang siya ng paakyat until it reaches to the right atrium. So, the muscles, the contraction of the muscles helps the blood to be pumped back into the right atrium in the veins. So, if there will be an incompetent valve, so walking the venous pressure of the foot will be only about 25 millimeters mercury kasi nga bumababa yung volume, kasi na-deliver back into the right atrium, and that's why the pressure also decreases up to 25 millimeters mercury. As compared, when you are standing for a prolonged period of time, you are not contracting your gastrocnemius, the pressure will rise up to 90 millimeters mercury, and that is not good. So we want a patent valve in the vein, because if there will be an incompetent valve, it will cause the valve to regurgitate back into the lower vessel. Kaya yung forward flow ng vein is affected even if you are contracting the muscles. So this is what we see in incompetent valves, such as in patients with varicose veins, or in patients with deep vein thrombosis, wherein the thrombosis obstruct the closure of the valve in the vein. So there will be edema in the lower extremity because of pooling of blood in the veins. And because of the pooling of blood in the veins, the pressure in the vein will increase. And then when the pressure in the vein increases, the capillary have difficulty draining into the vein. And that's why a volume of blood will go into the interstitial space, causing edema. Yay! Thank you! That's the end of the lecture. Now, I am opening the floor again. Kung meron pa kayong question noon at ngayon. Choppy, yun ang mga comments. Sorry. Sensya na po. Any question? Pag nakatayo ng matagal, when you stand for a longer period of time, let's say yung mga, di ba yung mga sa Buckingham Palace talaga yung example, no? Di ba nakatayo lang sila? Pag ganun, yung mga, guard? No? Nakatayo lang sila. So because of gravity, there will be pooling of blood in the veins. In hemodynamics kasi, basic hemodynamics, an increase in volume is tantamount to an increase in pressure if you don't do anything about it. So the vein will try to expand. Even if there is an increase in volume, it will expand. So somehow the pressure will decline. But if you have exceeded the ability of the vein to expand. Hindi na siya nag-expand, hanggang doon na lang yung capacity niya to expand. As still you are not moving, and then there is still a lot of volume of blood being pulled in the vein, and the volume increases farther, the pressure will increase farther. So sometimes the pressure in the vein will rise up to 90 millimeters mercury. Okay? And this is the reason why there will be edema in standing for a prolonged period of time. Kasi di ba, ang flow is pressure difference from higher pressure to lower pressure. The capillaries in the lower extremity should have a higher pressure than the veins. Tama? Para si capillary can drain into the vein. But if the pressure in the vein is higher than the capillaries, 90 millimeters mercury, 40 millimeters mercury lang ang capillaries, paano makakadrain yun? Di ba hindi makakadrain si capillary to the vein? So what will happen is the blood will go into the interstitial space because the interstitial space has a lower pressure than the capillary. Sabihin natin 10 millimeters mercury si capillary, si interstitial space, 40 millimeters ang capillary. Saan pupunta ang dugo? It will go to the interstitial space. It will not go to the vein. And so if you have fluid in the interstitial space, that's edema. Yun yung edema, a fluid in the interstitial space. Okay, if you contract kasi the gastrocnemius, it will squeeze the blood up back into the right atrium, decreasing the volume, decreasing the pressure. So from 90 millimeters mercury, the volume of blood will decrease. The pressure will go down to 25 millimeters mercury. If the capillaries is 40 millimeters mercury, the capillaries can drain to the vein, and that's the reason why walang edema. Now, merong mga pasyenteng nagko-collapse, nagfi-fainting, okay, when they are standing for a prolonged period of time, and this is because of venous pooling of blood. Yung blood, nandoon lang sa lower extremity, hindi na ibabalik sa right atrium, hindi nakakatulong sa stroke volume, nagdi-decrease yung blood going into the brain, fainting sila, no? So the technique is when they are standing for a prolonged period of time, they have to somehow squeeze the gastrocnemius by propelling the ankle. Alam mo yun, medyo ano bang tiptoe, a little bit tiptoe, and then down, and then tiptoe, and then down. Parang they have to really move. They have to really contract the gastrocnemius to squeeze the vein to prevent venous pooling. Yun yun. I hope naintindihan nyo yun.
Dok, same principle apply gyapon varicosities.
In varicosities, the problem is hindi siya normal eh. Ang normal vein kasi na walang varicose can distend. So it can accommodate a large volume of blood, and then the pressure will decrease kasi yung capacitance niya is okay. Yung varicose veins, these are veins na dilated, na walang distensibility. Talagang malaki lang siya, hindi siya expanded na siya. Wala siyang elastic recoil, alam mo yun? Wala siyang normal capability to expand and then recoil. Yung stress relaxation na in-explain natin kanina. Yung delayed compliance and reverse compliance to increase and decrease pressure in the vein or in the vessel. So nawawala yun sa varicose veins kasi in varicose veins kasi yung, di ba, kahit naman yung veins is more of elastic than smooth muscle, somehow meron yung smooth muscle that can expand and vasoconstrict, mga ganun. Pero in varicose veins, sobrang sira na siya eh. Palang dilated lang siya palagi. Hindi na siya masyadong nag-expand. Hindi rin siya masyadong nag-recoil. Kaya the distensibility and the compliance of varicose veins is affected. And so there is just venous pooling there. When you contract, it will really help. But if you don't contract, mas greater yung pooling of blood in varicose veins as compared to a person without varicose veins. And that's why those patients with varicose veins can have edema, especially at night. Pero pag gising sila, dahil naglalakad-lakad sila, nawawala yung varicose, yung edema, yun yung somehow will help me differentiate between a heart failure from a varicose veins, no? Mga ganon. Kasi pag steady lang siya, talaga nag-i-edema. And so patients with varicose veins or deep vein thrombosis, we advise them to use
Stockings.
compression stacking, because the compression stacking has different pressure. Merong 40. The higher pressure, kasi of the knowledge na pwedeng tumaas ang venous pressure up to 90 millimeters mercury. So you want higher pressure, mga 60 millimeters mercury, para compressed palagi yung vein, no? So somehow the pressure, the volume will decrease, the pressure will decrease. So nababawasan yung edema. I hope nakatulong yung answer ko.
Yes, Doc. Noted. Thank you.
Doc, what should patients with varicose veins do to improve the venous pressure? Sinabi ko na you have to put stockings. It will increase it. Meron kang constant compression, mga 60 millimeters mercury. Depende sa stocking mo kasi minsan yung stocking na ginagamit mo 10 millimeters lang or 20 millimeters mercury, kulang yun. So you want a higher pressure. Pero masakit din yun kasi imagine mo palaging may nakakompress sa'yo 60 millimeters mercury. So masakit din yun. So yun. Or you advise this patient to keep on contracting the gastrocnemius because the contraction of the gastrocnemius helps squeeze the blood back into the right atrium, therefore decreasing the volume, decreasing the pressure. Doc, during taking BP, what if it is not audible? Di wala kang BP. Di ba nag-deflate ka, wala ka talagang narinig, talagang may problema talaga. Ibig sabihin, decreased yung either cardiac output or total peripheral resistance. These are the factors that are involved in blood pressure. If there's no blood pressure, somehow the cardiac output is decreased and the total peripheral resistance is decreased. Now, take note that cardiac output is composed of the stroke volume times heart rate. So if the heart rate as well has decreased or the stroke volume has decreased, the BP will decrease. So if you cannot get the auscultatory BP, wala kang narinig na systole and diastole, think of possible problems. One, baka naman yung stethoscope mo naka-bell. Alam mo yun? Pero kasi siyang naiikot mo tapos nandun siya sa bell, hindi na nasa diaphragm. Baka yun, one factor yun. Or baka naman you're not putting your stethoscope on the artery, nandun ka sa pangit na artery. Or talagang wala talagang BP yung patient. Then try to do palpatory BP. Pag wala ka pa rin palpatory BP, talagang baksak talaga ang BP ng pasyente na yan. We have a concept in cardiology that if there is a radial pulse, the BP is like 80. Tama. And if there is a brachial pulse, the BP is approximately 80. And if there's a carotid pulse, the BP is approximately 40 millimeters mercury. Kaya kunwari may nag-collapse sa Robinsons, wala ka namang pang BP, kapain mo yung radio, malamang mga 80 millimeters mercury ran. Pag brachial lang nakakapa mo, hindi mo nakakapa sa radius, malamang mga, 60. Tama ba ko? And then sa carotid, wala kang nakakapa sa radius at saka sa brachial artery. Sa carotid mo lang nakakapa, malamang mga 40 ang BP nun. So ganun lang how to approximate that. So kung wala ka talagang makapang pulso, then you have to do something. Maybe you have to do CPR. Maybe you have to give inotropes. Maybe you have to give volume. So there are different factors to increase the BP. One, you can increase the heart rate because increasing the heart rate increases the cardiac output. Second, you can increase the stroke volume, meaning you give fluids to somehow increase the stroke volume because if you give fluid, you will increase the end diastolic return. And increasing the end diastolic volume will increase the stroke volume. Okay, so if you increase both the stroke volume and the heart rate, the cardiac output will increase. And again, blood pressure is cardiac output times total peripheral resistance. Another way to increase the BP is you increase the total peripheral resistance by giving norepinephrine, dopamine. These are medicines that increases total peripheral resistance. So if you play with the factors that increases the BP, again, importante, memorize mo. Cardiac output times total peripheral resistance. So if there is no BP, somehow the cardiac output is decreased, like in myocardial infarction, the muscle is not contracting, so the stroke volume is decreased, the cardiac output is decreased. Or there is arrhythmia, talagang hindi na bradycardic yung patient, the heart rate has decreased, so the cardiac output will decrease. Or there is decrease in total peripheral resistance, vasodilated lahat ng vessels, so blood pressure will decline. Ganun lang siya. Ankle pumping exercise, plantar flexion and dorsiflexion of ankles aids in blood flow. Thank you, 5N. Meron pang question? I like questions, really. I am opening, gusto ko yung meron tayong good communication to one another. When you cannot understand it, I will try to explain it. If I cannot explain it, I'm sorry.
Doc, what is the effect of bleeding to BP?
Okay. Ang daming mechanisms kasing nangyayari. So, if there is no mechanism to keep the BP up, binuno mo siya, gimbuno ka, tas you are losing like 2 liters of blood, then the blood pressure will drop. You will die. Alam mo bang the volume of blood inside the vessel is konti lang? Kasi the volume of fluid in your body, 2/3 is in the interstitial space, 1/3 is in the extracellular space. Tama? And in the extracellular space, 2/3 is in the interstitial space and only 1/3 is in the intravascular space. So 1/3 lang, no? 1/3 na nga yung extracellular, 1/3 pa doon sa extracellular ang nasa loob ng vessel. Kaya pag dumugo ka, as much as 500 ml to 1 liter blood loss will really affect your BP. So, what happens after that? Buti na lang, if you believe in God, buti na lang napakatalino ni Lord. Because there are a lot of mechanisms that happens in order to keep the BP up. One, there is a sympathetic discharge. Automatic yon. Which we will discuss further in the next lecture. When there is a drop of BP, there are a lot of mechanisms to increase back the blood pressure. So one is sympathetic activity. When there is an increase in sympathetic activity, the heart rate will increase, increasing the cardiac output. When there is increase in sympathetic activity, the contractility of the myocardium increases. Therefore, the stroke volume will increase. The cardiac output will increase. When there is increase in sympathetic activity, there is vasoconstriction of all vessels. All vessels, I'm not just talking about artery, but also veins. So if the arteries will vasoconstrict, the total peripheral resistance will increase and therefore BP will increase. When the veins constrict, kasi yung veins has like, meron siyang mga tinatagong pambato, mga 2 to 3 liters of blood. So if it vasoconstrict, it will bring back this volume of blood into the right atrium na makakatulong sa flow. Okay? So if you are losing blood, nandito yung autoregulation sa organs. Some arteries or arterioles in different organs will completely vasoconstrict na walang blood flow at all. In gastrointestinal system, completely vasoconstricted ang arteries nun, na walang nag-flow doon, walang blood supply sa intestines. Halos walang blood supply sa kidney. Okay? Walang blood supply sa muscles mo because you don't need that. So yung muscles, yung gastrocnemius, walang blood supply doon. Ang gusto mo lang, the blood will be in the brain and in the heart. Okay, all the blood will now be directed into the brain and the heart just to keep you alive. Walang blood supply sa muscles. Kaya imposible yung si Cardo na saksak, na buno, na pusil, tas nagdudurugo, tas sige dalagan, pak dalagan siya. Imposible yon. Your muscles will have no blood supply at all. Wala siyang blood supply, kaya hindi siya makakakontract. Okay? So these are a lot of mechanisms to keep the BP up.
Thank you, Doc.
Got ko yung question.
Will the pulse pressure also widen or elevate?
Narrow.
Probably. I think depende yon sa, ang dami kasing factors ang nakaka-affect nun sa isang tao. Kung normal lang ang pasyente, the stroke volume will be decreased. Pag nabuno ka, the stroke volume will be decreased. Although the total peripheral resistance will rise to keep the BP up, but because the stroke volume is decreased, somehow it will probably narrow down the pulse pressure. But kung nabuno ka and then you are losing blood, the body will try to keep the pulse pressure at a normal level, and the body will try to keep the mean arterial pressure at a normal level. Yan yung concept dapat. So, depende na sa disease ng pasyente if it's either increase or decrease. Kasi for example, if the BP declined because of sepsis, the BP dropped because of sepsis, the pulse pressure is wide, but the BP is low. Okay, ganun siya. So, depende sa kaso ng pasyente. But if normal yung pasyente and then nagdudurugo lang siya, it will try to keep the pulse pressure at 30 to 40 and the mean arterial pressure at 60 to 100. Up until yung mechanisms mo, wala na, hindi na kayang i-maintain yung BP.
Amo ni negative feedback, diba, Doc?
Yes, that's feedback, yes.
Doc, di ba hemorrhage, it will also trigger the kidney to increase the fluid absorption? Mga
No,
pero
no.
ito,
In hemorrhage, konti ang blood flow to kidneys. In hemorrhage, halos walang blood flow to kidneys. Kaya nga, if there is hypobulemia, mapapansin nyo yan, if there is hypobulemia, there will be acute renal failure. Talagang tumataas yung creatinine nila, and then nadadialysis sila. For example, we have, example lang to ha, on Monday, I was so toxic because I have a patient admitted at the ICU because of blood loss, nag-melena siya. Sobrang dami ng pupo niyang itim. The hemoglobin is like 57 and nag-hypobulemia siya. So because of the hypobulemia, the creatinine increased to 400. Nag-renal failure, nag-renal shutdown. So for dialysis siya. Yun yung nakakatoxic sa akin. So in hypobulemia, in blood loss, there will be no blood supply to the kidneys. Kasi hindi importante si kidney during blood loss. Importante among all organs is the brain and the heart.
oh, di rin yan Doc, compensatory mechanism para
Absorption of
ma-lessen
ano,
iton output iton fluid sa lawas.
Talking about the renin-angiotensin-aldosterone system, and that's different to blood supply to the kidney. That's different. Because the blood supply is, we are talking about the flow of blood in the renal arteries and veins and vasa recta. That's different. So if there is hypovolemia, there will be decreased blood flow to the kidneys, but the renin-angiotensin-aldosterone system will be stimulated. And that's different mechanism because in renin-angiotensin-aldosterone system, it's just hormones that is released. You are not increasing the blood flow in the kidney, but you are increasing the production of hormones from the kidney. And then in fact, sa renin-angiotensin-aldosterone system, renin lang naman ang produce ni kidney. Once the renin goes into the bloodstream, the angiotensin will be converted. Then dun siya sa angiotensin converting enzyme, which is in the lungs. You produce angiotensin, which is a powerful vasoconstrictor, angiotensin 2. It will vasoconstrict the peripheral vessels. Now it will go to the adrenal gland. It will stimulate the adrenal gland to produce aldosterone. Now this aldosterone will keep the renal tubules to reabsorb water to somehow maintain the stroke volume. Okay, so yun, magkaiba yun. When there is hypovolemia, yes, you stimulate renin-angiotensin-aldosterone system, but you decreased the blood flow. Okay?
Okay, Doc.
Okay, Doc, nasayod na, Doc. Kasi compensatory mechanism ito related to hemorrhage.
Yes, the compensatory mechanism in hypovolemia is a decrease in volume in blood flow to the kidneys, but a stimulation of renin-angiotensin-aldosterone system, and they work in different mechanisms.
So target niya is to produce secondary hypertension to compensate.
Yes. One
Okay,
of the
Doc, thank you.
which I did not say, kanina ang in-explain ko lang is sympathetic activity, but another factor is renin-angiotensin-aldosterone system. Now, take note, which we will expound in the next chapter. Renin-angiotensin-aldosterone system is for longer, alam yun, mas patagal, longer period of response. The sympathetic is immediate. Pag blood loss mo, sympathetic agad yun. Yung renal and aldosterone system, it will take naman how many days for that system to keep the BP up. Hindi naman siya like in a few minutes, agad-agad, pak, raas agad. Hindi, matagal-tagal siya. Longer yung ano niya, mechanism niya as compared to the sympathetic activity. I hope na-answer ko yung sagot ni Dane.
Thank you, Doc. Thank you.
Para tayong ano na, nasa ano. Salamat, Doc! Ang hirap, no? Kunwari, interview ka sa national TV tapos hindi mo alam yung sagot. Shucks, paano kaya? Paano ka kaya? Diyos ko, Lord. So, nag-lecture ako about COVID-19 sa mga laymans. Diyos ko, dahil mga tanong ng mga layman, talaga na-stroke yung utak ko. Butin lang parang may mga pang Miss Universe tayong pangsagot. Kaya nairaraos. Questions?
Doc, ano to mo mayayakan about kan Dr. Farah?
Hawks pang term yan. Quack. Sorry. Pwede naman, medyo nabibisi lang yung beauty ko kaya hindi ko siya nasisend. Pero I hope you are recording. Kakaya nyo, nire-record nyo yung beauty ko lahat ng pinagsasabi kong. Anyway. Ayaw ko kasi ng recorded kasi gusto ko yung naririnig nyo yung both my correct and my mistakes. I don't want it to be too perfect. Questions?
Doc, may
Hey,
ka-clarify la po. Hello po. May ka-clarify la po. Ohm's law po. Ang relationship between pressure and resistance po.
Hmm?
Yun po. Ano po to try mo ginyakan about?
Ohm's law states that the flow is directly proportional to change in pressure, meaning if the pressure increases, the flow will also increase. But it is inversely proportional to resistance, meaning if you increase the resistance, you decrease the flow. If we use that on what's really happening on the vessel, if you vasoconstrict a vessel, you decrease the lumen, you increase the resistance, walang makakadaloy na dugo. Yan. Tandaan mo yan. Lalabas yan sa exam. If you vasoconstrict the vessel, because you have increased the resistance, the flow will decrease. According to Ohm's law, flow is inversely proportional to resistance. When there is an increase in resistance, the flow will decrease. If the resistance will decrease, the flow will increase. So if the vessel lumen or radius dilates or increases, you decrease the resistance and therefore the flow will increase. When you vasodilate a vessel, there will be an increased flow. When you vasoconstrict a vessel, the flow will decrease. Ohm's law. Ang hirap, no? Kailangan mo talaga siyang i-memorize yung 4 na formula na yon by heart because that's the gist of cardiology kasi. Alam mo, cardiology ako, pero minsan nakakalimutan ko rin yan. 4 yun, volume flow rate, we have Ohm's law, we have Possessed law, and the venous capacitance formula.
So Doc, if
Meron pa yung formula, dadagdagan pa yan. And if you go into pathophysiology na, meron pang Laplace law. Nakakaloka si Laplace law, Diyos ko Lord. Makaka-stroke yung Laplace law. Yes, you were saying, Paul?
Doc, and pressure, if let's say increase in pressure, maano pan resistance?
Okay. If the resistance increases, the pressure, magkaiba siya eh. Because in Possessed law, it states that resistance is inversely proportional to change in pressure. Okay? Which means that if the resistance increases, the pressure will decrease. That's Possessed law. Tama? Agree ka ba? So, if the pressure will increase, the resistance will decrease. Kaya nga, ang nangyayari, ang nangyari, if you vasoconstrict a vessel, because the flow will be decreased kasi hindi siya makapasok eh. Somehow the pressure will also decrease. Now don't be confused because there is an increase in pressure and a decrease in pressure. Baka dito tayo nako-confuse. If this is a vessel, you constrict over this area, no? Constrict mo yung gitna. Dito sa area na to, the pressure will rise. Kasi you have vasoconstricted that, there will be pooling of blood in this area. Increase in volume, increase in pressure. Okay?
Artery, Doc, or vein?
Artery or vein, kahit ano yon. Now sa kabila, because hindi nakapasok yung dugo, decrease yung volume of blood na pumunta sa kabila. Decrease volume, decrease pressure. Yun. Now, yung pinag-uusapan sa hemodynamics kasi, walang ano yun eh. Ito lang siya eh. Tube lang siya. Sa artery natin, nag-iiba talaga ang mga nangyayari. Kasi meron ng differences. Merong pre-constriction and post-constriction na changes. Pero ang pinag-aaralan pa lang natin ngayon is the basic concept. Hindi pa tayo pumupunta doon sa abnormal. Merong student na nagtanong about coarctation of aorta. I think that's a good example. That's an abnormality, congenital abnormality. In coarctation of aorta, on the constricted area, before the constricted area, the vessel is dilated. And after the constriction, the vessel is like, parang maliit siya. Kasi nga, konti yung lumalabas na dugo doon. So before the coarctation of aorta, the pressure is high. The pressure is high because of an increase in volume. Kasi there will be pooling of blood there. And then the volume increases, the pressure increases. Kaya nga, sa upper extremity, mataas ang pressure in coarctation of aorta. Now, after the constriction, because konti yung lumalabas ng dugo, the volume decreases, the pressure decreases, kaya mababa ang pressure sa lower extremity. That's pathophysiology. But here in physiology, we are just talking about the basic concepts in hemodynamics. Palang, nakakaloka. Oh, basic hemodynamics palang, lalo na kung gamitin mo siya sa pathophysiology. Doc, in atherosclerosis, does it affect the blood flow? Somehow, hindi masyado. In atherosclerosis, there will be a rise in systolic pressure because the artery did not distend. Hindi siya nag-expand. So based on capacitance, a decrease in capacitance means a decrease in, increase in pressure. However, even if because the pressure increased, an increase in pressure according to the volume flow rate, velocity is equal to pressure, no? Over inversely proportional to cross-sectional area. So if you increase the velocity of blood, you increase the flow. So somehow, because on atherosclerosis, the systolic pressure increased, ang bilis ng flow in the aorta, madideliver niya agad to the circulatory tree. But the effect there is an increase in systolic pressure. Kailangan talaga, no? Memorize niyo muna yung bawat formula. Anong gagamitin niyo siya in different pambato niyong sagot. Kaya pag Miss Universe ka, dapat marami kang memorize. According to Mother Teresa, mga ganung pangsagot. According to Barack Obama, kailangan marami kang memorize kasi yun yung pangdulong mong sagot. And I believe that mga ganon. So here in physiology, you have to memorize different law and be able to use it in how you explain. Kaloka. So kailangan daw, pag doktor ka, meron ka lang common sense. Pag walang sense, walang common. So, nasagot ko ba yung sagot? In atherosclerosis, the flow is faster, but the pressure is high. Okay. I like questions. I really like questions.
Hello, Doc. Good morning po.
Hi.
May pakialala po. I'm Bidwa po.
Yes.
Regarding po capacitance po, Doc. Capacitance meaning po pag-expand or elasticity po in blood vessels. So
Yes.
meaning the higher the capacitance, mas dako ang blood flow, so mas tataas ang blood pressure.
Di masyado. Parang na confuse lang ako ng konti. Capacitance is the expansion of the vessel. Okay? When you expand the vessel, it will be able to contain volume of blood. But at the same time, so somehow the flow will be declined.
Okay po. Okay po. Thank you, Doc.
Because flow and pressure is if you increase the pressure, you increase the flow. If you decrease the pressure, you decrease the flow. So the vein, when it expands, you decrease the pressure. Kasi nag-expand siya, in-accommodate niya yung increase in volume. Pag hindi siya yung vein, pag hindi siya nag-expand, there will be an increase in volume, there will be an increase in pressure. Somehow, the flow will be strengthened. But hindi naman ang function ng vein lang is to deliver blood back immediately to the right atrium. Hindi siya lang ganun eh. Ang function pa ng vein is to be a reservoir of blood. So it functions more as a reservoir, meaning to contain volume of blood, and a little bit to return blood into the right atrium. So don't be confused between the two functions of the vein. Now, it is a reservoir because of its high capacitance and distensibility. It expands when there is an increase in volume. By expanding, the pressure will decline. Because if the vein will not expand, the pressure will rise. No? The pressure will rise. And so the flow will pupunta yan, babalik yan sa right atrium. It will be delivered to the right atrium. In fact, if you stimulate sympathetic activity, the smooth muscle and veins are stimulated, and then there will be constriction. And so when you constrict the veins, the capacitance decreases, the pressure increases, the flow increases, and that's why yung tinatago ni vein na 2 to 3 liters will be delivered back into the systemic circulation and to the pulmonary circulation and back again to the systemic circulation. Kaya pag sinaksak ka, meron ka pang reservoir of blood, mga 2 to 3 liters. Kaya pag sinaksak ka and then you lost blood about 1 liter, it is enough to decrease the blood pressure but not enough to kill you. Kasi meron ka pang 2 to 3 liters of blood in the vein. So there will be mechanisms na ibabalik yung the veins will try to give a little bit of 1 liter. So madadagdagan uli kahit nabawasan ka. So you need to fastly, alam mo yun, occlude kung ano man ang nag-bleed. Kasi otherwise, pag more than 3 liters ang blood loss mo, yung tinatago mong reservoir is just 2 to 3 liters, you will die. Di ba sa operating room, tinitingnan na yung mga nurses dyan, nagtatanong yung doktor, ilan ba ang blood loss? 500. Ay, thank you, 500 lang. Ilan bang blood loss? 1 liter. Naku, 1 liter na. Ilan bang blood loss? 2 liters. Oh, get a blood, transfuse blood. Di ba ganun na ang surgeon? 2 liters ng blood loss mo, 3 liters ng blood loss mo. Yung doktor, yung anesthesiologist, aka yung surgeon mo, talagang nagmamadali na ikaw na nurse. Wala ka lang, hindi pa tumatakbo yung utak mo. Magmamadali ka lang kung sasabihan ka na. But as a doctor, your mind should be to think what is happening in the hemodynamics. That if there is a blood loss more than 1 liter, mahirapan, mamamatay si pasyente because your venous capacity, the reservoir of blood is just 2 to 3 liters. Nagigets niyo ba kung bakit nagagalit yung surgeon na ang tagal-tagal mong hanapin yung dugo? Siguro ngayon na yung mga nurses dyan, tapos nag-medicine na ngayon, siguro, kaya pala pinapagalitan ako ni Doc, no? Kaya pala sigaw ng sigaw, stress ng stress na si Doc nang sinabi kong 2 liters na yung blood loss. I hope nasagot ko yung answer.
Kayo duguri ni Doc yung ligate laan.
Minsan kasi, alam mo, dapat ligate, dapat. Pero minsan, minsan naman kasi oozing lang eh. Hindi siya like a big vessel dripping with blood. Kasi pag oozing yun, paano mo naman ilaligate yung oozing lang? Although minsan nahahanap yung nag-ooze, pero talking about that, the second patient na nakakatoxic sa akin on Monday was an ICU patient na has a gastric mass, and then it has parang pumailalim siya sa pancreas, and then dumikit na siya sa pancreas. So habang tinatanggal ng surgeon yung mass away from the pancreas, doon na nag-uus doon sa surface ng pancreas, no? Bleeder. Kahit siya nag-bleed pa rin. Cauterize siya ng cauterize, bleed pa rin ng bleed. So yun yung tinatawag na oozing blood. Wala siyang spurting na vessel na kaya mong tahiin. Hindi siya gano'n. Pag oozing blood lang talagang nagdidrip lang siya sa capillary level. So the patient lost about 2 liters of blood. We were able to transfuse 2 liters of blood, and then ang hirap maghanap ng blood ngayong ngayong pandemic. The patient had a cardiac arrest from hypobulemia, was intubated, GCS3. Eventually the patient died. So on Monday, I lectured up to 10 o'clock. After our lecture, mga 9:40 tayo natapos. After our lecture, nagbiyahe ako agad to ACE Medical Center. Around 10:30, nag-usap-usap kami sa family about not doing anything anymore. And then the patient died at around 1 o'clock. Ganun ako katoxic, no? And then, at around 3 o'clock, family meeting naman kami. Sa isa kong patient in ICU, the other one, I was talking about na nagmilena. And then, we talk about GCS6 na kasi siya. And so, hindi na kami nag-do anything to do the surgery kasi intra-abdominal mass din yun, I think. So, ngayon, yung pasyente, dinala na lang nila sa barangay. Daming chismis. This is, yan yung beauty ng isang clinician teaching. Kaya ako nagtuturo Kaya gustong-gusto kong magturo in physiology. Because every night, before ako mag-lecture, nagbabasa talaga ako, nakakaloka. Kaninang madaling araw, 1 o'clock ako natulog just to read. Like ilang yung chapter natin yun is like 6 pages lang. Pero paulit-ulit ko siyang binabasa kasi baka yung mga estudyante ko magtanong tapos hindi ko masagot, nakakahiya. So paulit-ulit ko siyang binabasa. But by reading constantly, nagagamit ko talaga siya clinically. As in, promise, nagagamit ko siya. Pagdadating ko doon sa pasyente, tumatakbo yung utak. Ito yung mga diniscuss ko about capacitance, about resistance, about... I am also benefiting from this lecture. So, learn and use the knowledge. Question? Wala na?
Dok, paano mag-keep them composure kung mga sugad na situation?
Okay, I was not this confident even before. Kung nakita niyo ako when I was intern, that's good tatanungin ako, nga. Wala akong alam. Tapos, residency, tanga-tanga din. Cardio fellow, medyo, I gained so much confidence during fellowship in cardio training. Kasi I trained in St. Luke's Global. And then doon talagang yung mga tao puro, parang lahat excellence yung culture. So, aral ka ng aral. And then yung mga consultants namin doon, talagang mga artista, yayabang. So, parang kailangan mong mag-keep up. You really had to read. And then, during conference, pag nagdi-discuss ako, nakakasagot naman ako. So, somehow, nagva-validate yung sarili mo by that. So, in order to learn, you need to read. When you read, kasi you learn. And then when you learn, you need to gain experience. When you gain experience, yun yung stronger, yun yung bibigay sa'yo ng confidence. So ngayon, I am more confident than you are. Kahit mag-aral kayo ng mag-aral, mas matalino kayo sa akin. Kasi average student naman ang yung IQ ko. So kahit mag-aral kayo ng mag-aral, yung confidence natin magkaiba. Because of experience. So teacher is... pag mag-aaral kayo, mas magaling kayo sa teacher But because of experience, mas nagiging magaling lang yung teacher. So ganun lang yun. Yung mga questions nyo, naitanong na sa akin, luckily. Kaya nasasagot ko siya. Kasi na-experience ko na siya. Itinanong na sa akin before, hindi ko nasagot. Nagtanong na rin ako before, nasagot na sa akin. So na-experience ko na siya. Pero pag tanungin ako, ng question na hindi ko pa na-experience at hindi ko alam, Doon, hindi ko talaga siya masasagot. But it just so happened na I'm already a consultant and I'm already in a point of my life that I don't need to prove anything anymore. I don't care. Kahit sabi, ay, hindi niya alam, bobo. Kemi lang, okay lang. Confident pa rin yung beauty ko. So, I opened the line for questions because I want to answer the question. I want to know if my student understood the lecture. And at the same time, I don't have to prove anything anymore. Doc, can you give a tip on how you study? Ang hirap, no? When I was a student, aral lang akong, grabe, no? Grabe akong mag-memorize. Yung isang paragraph sa libro, pati yung and, if, memorize ko yon. Talagang galing-galing mag-memorize. And then you realize, pagdating doon sa exam, kailangan magaling ka rin mag-analyze. Kahit memorize mo siya, pag hindi ka magaling mag-analyze, marorong ka. But if the question is simple recall, you can answer. Let's say, ang question ba ay, what is the formula of blood pressure A in cardiac output
Ganito,
B?
Doc. Amo ito, gusto nga kuan.
B,
Question.
and so makakasagot ka kasi simple recall siya. But kailangan mo siyang i-analyze talaga. So you need to use your brain, not just your memorization. No? Paano ba? How to state that properly? Analyzation is important. So, ang mga matatalino daw mag-aral, they know what to memorize. And then, minsan, konti lang yung na-memorize nila, pero ang galing nilang mag-analyze doon. Kunwari, letter A, hindi nila alam, pero sa letter B, na-memorize nila, natanggal niya. Sa letter C, na-memorize niya, alam niya, natanggal niya. So, A and B, A and D, hindi niya alam. So, magdideduce siya. 50% na yung accuracy niya kasi natanggal niya yung dalawa eh. So, ngayon, you will now rely on the prayers and luck of lahat ng mga kanunuan mo who are praying for you na mapili mo yung tama. Or if you are blessed, if you are really destined to be a physician, maraming ganyan eh. Ako, nakapasa ako sa board exam, tas when I was thinking, paano kaya ako pumasa, no? Hindi naman ako ganun ka super talino, pero pumasa din ako. So, I must have been probably destined to be a physician. So, yung iba din na matatalino, they think as a teacher. May mga matatalinong ganun. Iniisip nila kung ano ba talaga ang possible na lalabas sa exam. Kasi kung memorize ng lahat, hindi naman pala lumabas doon yung sa exam, hindi ka rin nakasagot. Samantalang isang slide lang yung memorize mo, tapos nandoon yung 5 questions, swerte. Swerte yun. So you know what to memorize, know what to read. Pero tingin ko papasa din kayo lahat. Don't. Everything will just fall into right place. So just keep on studying and then just do your part. And everything will go into right place. Kung hindi ka man pumasa ngayon, bawi ka next time, papasa ka pa rin. Pero pag talagang hindi ka pumasa, good luck. Ang concept ko, every student should be able to get a score of 50% or more. Nag-aral ka man or hindi, dapat maka 50% or more ka. You rely on luck and the prayers of your ancestors. Yes. Actually, parehas sila. Indirectly proportional. In both equation, they are both inversely proportional. Yung resistance at saka pressure. Kaya hindi ka maguguluhan doon. Maybe you just have to practice more. Ohm's law, flow is directly proportional to pressure, but inversely proportional to resistance. Poiseuille's equation says that resistance is inversely proportional to change in pressure. So they are both inversely proportional. Baka naguluhan ka sa regular na Poiseuille's equation, yung flow is equals to change in pressure times radius. Okay. Kasi ginamit siya in terms of resistance by mathematical equation. Resistance is now inversely proportional to pressure change. So ganun pa rin. Inversely proportional si resistance and pressure in Poiseuille's equation as well as in Ohm's law. They are both inversely proportional. $9.59, 1 minute. Pahabol na question.
Hello, Doc. Hello.
Yes.
Hello.
Boone.
May short question lang po ako, Doc. Ilan yung parang troublesome na palpatory BP? Kasi di ba usually pag in practice, kumukuha ka lang ng palpatory BP pag unappreciated na sa auscultation. Parang ilan yung masasabi mo na pag like mag-report na palpatory 60 ba or 50 na parang alam mo na parang wala na kahit
Below
station o ano.
Below 100 bone, I don't like it.
Okay. Thank you, Doc.
So pag sinabi sa akin palpatory 80, alam mo nang I will do something. It's either I will
Norepi.
or I will give norepi or dopamine.
Prayers.
It will, yes, prayers. It will now depend on the information being given to me by the nurse or my resident. Say, for example, the patient came in because of diarrhea and now the BP is palpatory 70, then I know that it's volume. Please mag-fast drip ka up to 1 liter. Tatanungin ko, ano bang timbang ng pasyente? Kung hindi na timbang kasi emergency, tingnan mo, i-approximate mo yung pasyente. Let's say 60 kilograms. So I want 5 ml per kilogram. So 5 times 60, yun ang ipa-fast drip ko. Is the patient old with cardiac disease? I want to hydrate like 1 ml per kilogram lang. So 60 times 1, then 60 ml lang ipa-fast drip ko because I don't want too much volume. Baka
Cardiac overload.
Yes. So it will now depend on the case. That's why I am listening. And that's why it's important that my resident has good physical history na i-feed sa akin. So if you are a consultant listening, you should know, aalamin mo kung tama yung pinagsasabi ng pasyente, ng resident mo. So to answer Bonnie, it's less than 100. If the palpatory BP is less than 100, I don't like it. I want to keep it up. Actually, any palpatory BP is not good. Pag palpatory BP, it's not good, really. But my cutoff is 100. Wala na?
Thank you, Doc.
If you have some more question, you can text me, and then, or you can ask me on the next lecture. Thank you. Good morning.
Thank you, Doc.